In the last 2 months, with a collective effort of the City of Dallas, Dallas County, the federal government, the state government, and the private sector, we've seen significant increases in COVID-19 testing in the City of Dallas. We know this in large part because we've been tracking it. At the beginning of our response, I issued emergency orders requiring the reporting of tests conducted in the city. We knew then that testing and data collection generally would be critical to our public health response and our recovery efforts. But, like everywhere else in the United States, we need far more testing. As of today, we have still tested less than 2% of our population in Dallas County for COVID-19. And with businesses gradually reopening in Texas, the need for a more robust testing regime and a focus on healthcare access is even more vital to ensure public health and to restore our vibrant economy. I am not interested in finger-pointing or playing the blame game with testing availability. We are where we are, and we know we aren't where we need to be. Regardless, we have been grateful for the federal and state support we've received so far, and we appreciate the work of Dallas County, our contracted public health authority, and some of our private partners to bring more testing and improve healthcare access in the city of Dallas. But COVID-19 has required a multifaceted response, and testing and access are just a piece of a larger effort. And as much as we rely on Dallas County as our public health authority, about 44% of the county's confirmed cases are not City of Dallas residents. Our job as city leaders is to look out for our residents' interest. Currently, none of us here at Dallas City Hall have an expertise in testing or in analyzing health disparities in our communities and recommending measures to overcome them. While we haven't yet seen disproportionate health outcomes by race in the Dallas County data, national data has shown some broad disparities by race, ethnicity, income, and other factors in COVID-19 hospitalizations and deaths. In our city, I'm concerned about the many families that don't have the same access to health care and testing as others. It's become clear to me that we need someone who can work with all of our partners, but is singularly focused on these complex issues for our residents. That's why I'm excited to announce today that I have asked Dr. Kelvin Baggett to serve as the City of Dallas COVID-19 Health and Healthcare Access Czar. Dr. Baggett couldn't be here with us physically today, but I know that he's excited to take on this challenge. I'm sure you'll be hearing from him in the days and weeks ahead. He has a very impressive background as a healthcare executive and physician, and he understands and embraces the challenges that I have asked him to take on. We have to make sure all of our communities have access to testing, that we are effectively conducting contact tracing, and that our residents have access to health care. Dr. Baggett expects to work with the City of Dallas, Dallas County Health and Human Services, our hospital systems, our private sector partners, faith leaders, academic institutions, and the Task Force on COVID-19 Economic Recovery, which, as you know, is being led by former President and CEO of the Federal Reserve Bank of Dallas, Richard Fisher, and the Beck Group CEO, Fred Perpall. This is an all-hands-on-deck situation, and it has been from the start. This pandemic affects everyone, not equally, of course, but no one is immune to the effects of this insidious virus on public health and our society, broadly speaking. I'm very grateful to have Dr. Baggett on board. I'm someone who believes in the importance of science and the power of expertise. I'm also a believer in the intrinsic value of communities. We cannot leave any of our city's people behind in this response. We have too many divisions in our society as it is. This disease has pushed us away from each other physically, but we cannot let it tear us apart and deepen the divide in our city between the haves and the have-nots. I am extremely proud of how the people of Dallas have responded so far to this unprecedented pandemic. We've seen a lot of voluntary compliance, individual responsibility, and incredible generosity and kindness. I know this has been difficult, but Dallas, as always, has risen to the occasion. But I also want to say, I realize that not everyone is getting the message about how serious this pandemic is. We need every single person in this city to recognize that they have a role to play to get us through this situation quicker. This virus is still spreading. People are still dying. We need you to hang tough. Wear a mask when you are out in public. Wash your hands regularly. Practice social distancing. Now is not the time for a party in the park or at your house. We're not out of the woods yet. There will be a time to celebrate in this city because we're going to get through this. And I look forward to that day. It's just not today.